Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
The skin is the body's largest organ. Now think about it that, you sort of think it's the liver, but it's the skin. And diseases of the skin can occur anywhere, including the genitals, your private parts.
Your private parts. Skin issues related to the genitals can be itchy, painful, and embarrassing, but they're actually fairly common. On today's program, we'll talk about some of the more common genital skin problems in males. Our guest is Mayo Clinic dermatologist Dr. Dawn Davis. Welcome back to the show.
Thank you, Tom and Tracy. It's my pleasure to be here. And thank you for allowing me to talk about men's health because it's very important.
And let's start with Pearly Penile Papules.
Yes. Pearly penile papules are a common reason that men seek dermatologist input because up to 40% of male adults have pearly penile papules on their penis. And essentially what they are little small pearly beads that usually happen around the coronal sulcus or the bottom of the head of the penis. And they look like little frog spawn or caviar nodules or little tapioca pudding eyeballs that hang off of the coronal head of the penis. And they're simply an overgrowth of blood vessels that happen probably due to friction because the genitals are busy. They sit in clothes and you walk and you sit and you do all sorts of things. And they can scare a lot of men because people think that they're a cancerous growth or an infection, and they worry that they might spread it elsewhere or to their partners.
But nothing to worry about.
They're absolutely nothing to worry about, but we need to distinguish them from other things that can be worrisome, like sexually transmitted infections. But
and you said quite common.
They're very common. Up to 40% of men who are adults are thought to have pearly penile papules on their penis. You can get treatment for them if you don't like them. They're cosmetically bothersome to you. We can trim them off or freeze them off, but unfortunately they tend to regrow because they were thought to be due most likely to friction, although we can't necessarily prove that.
I think I'd keep mine. Will you freeze them off, did you say?
You can. Okay. You can freeze them off or you can remove them by the small biopsy procedures or perhaps laser, but they simply regrow because we don't know exactly why they occur, but we believe they occur because of friction.
Do they come and go then?
They don't usually come and go. Once they come, they stay.
They stay. Okay.
All right. You mentioned, inferred that you can actually have cancer of the penis. True?
Yes. So squamous cell carcinoma. So you can get cancer anywhere on the skin, and you can get multiple different types of cancer. And that also includes the penile area. If a gentleman is going to have skin cancer in his genital area, it's most likely squamous cell carcinoma, which is a skin cancer that most people are familiar with. They just don't think about it happening on the genitalia. And it can happen on the penis. It's much more common on the penis than elsewhere in the genital area in men. When that happens, it's usually on the penile head or on the foreskin, especially if you have certain risk factors. Men are more likely to have squamous cell carcinoma on the penis if they have uncircumcised skin, or if they have a long-term history of smoking, or of diabetes, or of genital warts, or if they have a suppressed immune system or a ton of sun exposure.
You said a genital wart. How different does it look from a genital wart?
That's a great question. So squamous cell carcinoma can look like an erosion, sort of like you abraded something, like you skinned something if you fell down and skinned your knee, but instead you skinned something else. It can also look like a growth. Warts tend to look like a wart. They tend to be small and attached at the surface, and then they have like a pebbly surface. And a lot of times you can see little punctate hemorrhages or little dots of blood under the surface of the scaly skin, which are the wart's own blood supply. Warts survive so well on the skin because they grow their own blood supply. They're very smart. Warts are caused by a virus called HPV. Now, having certain strains of HPV makes you more likely to have genital cancer, which is why with certain celebrities being more open about their health history, we know that certain HPV strains can cause anal rectal cancer and things, but they also can cause genital cancers, including of the penis. So we like to treat genital warts proactively. And we also, of course, want to detect squamous cell carcinoma on the penis.
I'm going to try to say this as well as you do. Does a pearly penile papule look like a skin cancer or a genital wart?
No, a pearly penile papule is very small, and it looks like a little water droplet hanging from the coronal head of the penis versus something that's a wound that's either eroded, like you skinned yourself, and it's not healing after 2 to 3 weeks, especially if you don't have a reason for you to have a wound, or if it's a tumorous growth, it's a nodule that is stable in size and keeps growing or is painful. We'd want that to get assessed.
It seems like now we should talk about contact dermatitis because of what you just were saying.
One more thing. I hate to ask, but what's the treatment for cancer of the penis?
That's a great question. It just depends on where it's at and how deep it is. And so the first thing is detection. So making sure that gentlemen are aware that the disease can exist so that they come into their primary care provider, a dermatologist or urologist who's a penile special surgeon, so that we can detect it and take a small biopsy of the growth or the erosion to make sure that that is indeed squamous cell carcinoma. Because part of the problem with squamous cell carcinoma on the penis is you don't necessarily look down there all the time, and you're a little embarrassed to go to the doctor, or you just don't think it can exist. So if you don't know that something exists, you can't go to the doctor to get it figured out. And so the issue with penile cancer is awareness so that we can have early detection.
So that would mean you could potentially remove it locally without an amputation.
Yeah, we're hopeful. Yes, absolutely. That would be our goal.
All right.
All right, that contact dermatitis.
Yes, contact dermatitis. So I think people are well aware that the skin is the largest body organ. Thank you very much for promoting my favorite organ. And it regenerates 24 hours a day, 365 days a year, and it has a lot of skin surface. It's the size of an NFL football field if you were to stretch it out, which is why it's the largest body organ. But what's so interesting is we think about being contact allergic to various things. Like, for example, people can be sensitive to nickel. And they think about that if they get an itch under their watch or under their rings or their earrings. But we forget that the genitalia sees a lot of different chemicals because of soaps and perfumes and over-the-counter medications. And it gets a lot of activity because of friction and sweat and occlusion with wearing clothes and sitting down and standing up and walking and running. And so the skin down there gets a lot of trauma just with natural activity. Plus, it has a very good blood supply. And in the genital area, the scrotal skin is very thin. And so that makes you predisposed that if you're kind of a sensitive person, you could develop an allergic contact dermatitis to things that you're using in that area. And then you'll have a red, burning, itchy genitalia. And you might think it's jock itch, or you might think it's a sexually transmitted infection, when actually it's a preservative or a chemical in something that you're using, like a body wash or an over-the-counter lotion or something.
Or condoms. Can you be allergic?
Yes, absolutely, because condoms have rubber and latex. Even the ones that are rubber and latex free have other chemicals that you can be allergic to. A lot of them have lubricants that you can be sensitive to. So yes, absolutely.
All right. What about, you talked about genital warts. What about genital herpes?
So,
and by the way, you mentioned that if you have genital warts, they should be treated?
Yes. So we like to treat genital warts, first of all, because we care about your own health and we don't want them to spread. And certain strains of warts can be oncogenic, meaning predisposing you to cancer. Secondly, we don't want it to spread to other people if you're sexually active, because once you acquire the HPV virus, it's difficult to eradicate entirely. So warts of the genitalia are caused by HPV, the human papilloma virus. And there are over 100 subtypes of human papilloma virus, but certain subtypes predilect for certain areas of the skin. And then herpes or canker sores are caused by the herpes simplex virus, which can be present in your mouth or can be present in your genitalia. And we used to think that one form of herpes was only for the mouth and another form of the herpes virus was only for the genitalia.
Type 1 and type 2.
Correct. Yeah. But now we know that that's not the case, that you can have either type in either location, although one is more common in one area than in another. And so we like to also treat you for the herpes virus because we don't want you to have difficulty from that.
But you can't cure it. Right?
No, you house the virus once you've acquired it for the rest of your life, but we want to control it so that you don't spread it to others.
But can't you spread it to others even if it's not active?
You can. You can spread the herpes virus to others, especially without sexual precautions like condoms and things like that. But having an active florid infection increases your risk of transmission more than having a treated infection where you're simply a carrier instead of having a carrier with an outbreak.
All right, we hit many of the common ones, skin diseases of the genitals. And if you're a man, it can be embarrassing to make an appointment to see your doctor if you've got a rash or a lesion down there. But it's important. Some conditions can lead to permanent skin changes, even cancer. But most issues can be treated and cured if you seek help. Our thanks to Mayo Clinic dermatologist, Dr. Don Davis. Thanks for being here.
My pleasure.